One of the biggest problems today we face is clinician burnout. Let's reframe the conversation. Burnout implies that there is an intrinsic problem. All clinicians, nurses, physicians have worked very hard. They have intrinsic grit and resilience. Burnout should be rephrased to moral injury. Moral injury happens when we perpetrate, bear witness to, or fail to prevent an act that transgresses deeply held moral beliefs. There's a constellation of symptoms: malaise, fatigue, frustration. Worst of all, in my opinion, is cynicism, which basically means that everyone is out for themselves. This can be very dangerous because we all work in tightly integrated teams. And if you don't have trust, that could be a big problem and can lead to medical errors. And that's what I'm going to discuss next. Officially now, burnout is considered an ICD-10-11 diagnosis, and World Health Organization defines it as a syndrome conceptualized as resulting from chronic workplace stress with following symptoms. This is not new. The National Academy of Medicine put out this report back in 2019. And back then, it was considered an epidemic. About 35 to 54% of doctors and nurses were experiencing burnout at some point in time. This is a very, very big problem. And unfortunately, after the COVID-19 pandemic, this might actually even get worse. The impact of COVID-19 has also been studied. As you can see, people are considering sleep as an issue, and then exposure, stress, etc. Check out these articles that discusses them further. It's not just that it has implications, personal implications, which I'm going to go into, but it's extremely costly. About $4.6 billion is related to physician turnover, reduced clinical hours, iteration issues, retention costs, hiring costs, etc. It's a significant economic burden to the health systems in general and country as a whole that burnout produces. Other big issues, of course, these three things, which is a fantastic study that was done, and this is a meta-analysis that was completed in 2018. Number one, increased risk of patient safety incidents. If you're burned out, then the odds of you having a patient safety incident, it doesn't matter if it's a mistake or not, just having incidents in general, it goes to about twice. Lower professionalism, clearly, if you're not happy, you're going to have poor professionalism, which leads to poor quality of care. And the odds are, as you can see, it's 2.31, which is significant. And clearly, people sense that. I mean, your patients are able to know if you're not that engaged, and that clearly leads to decreased patient satisfaction. One of the studies that was done recently in Mayo Clinic proceedings actually reported that because of the burnout, the incidence of medical errors can go as high as 3 times. Again, this is not only a professional issue, this is not only a money issue, this is actually clearly a health safety issue. There are significant consequences, as I discussed, about the professional side of things: decreased patient satisfaction, productivity, turnover, etc. But personally, when physicians are burnout or moral injury, you can see that there is an increased risk of suicide, depression, alcohol abuse, etc. And they pay a very heavy personal cost to this. Which physicians are the most, which physicians are most affected by the burnout? If you can see, it's critical care, neurology, family medicine. This is the 2018 list. Physicians who are A, have an increased demand on their time, B, have to respond to emergencies, and C, are dealing with chronic care issues or with bad outcomes, are worstly affected. So it's just not about, it's also what I'm trying to say here, it's about the human emotional side of things. When more physicians that are generally involved in care, which have possibly a bad outcome, are having discussions with family about goals of care, are the most affected. The biggest contributors, according to the survey that the clinician said, is clerical work. I'm here to provide care. I'm not here to do basically paperwork. That's number one thing. And then, of course, the way the systems are changing, there is a lack of respect, which thankfully, at least after the pandemic, at least people have realized that physicians have been working that hard and now are going to be asked to do more and more. The problems and possible solutions that where telehealth, virtual care, telemedicine comes in. And that is the key thing. Number one, the biggest issue is excessive workload. And where is the excessive workload is the most problematic? Weekends, holidays, and nights. What telemedicine can provide is geographical load balancing. You can have a provider that is sitting in Texas asking help from somewhere in California to actually cover their patients. So the Texas physician can actually have some time to sleep while the California covers, and vice versa. So this load distribution on a grand geographical scale can only be achieved by telehealth. Work efficiencies and paperwork automatically by design gets better with telehealth because specialists are taking care of the specialty problem, and then primary care physicians are providing consistent care through tele as well, while in person they can have a workflow that is designed to improve patient paperwork issues. The documentation, the clinical documentation requirements are less because most of the time when you're providing care over tele, it is time-based. Responsibility and response times, I told you, those physicians are higher risk where their response time is less than 5 minutes, like stroke physicians. That's where neurology also comes into play. The last thing is loss of control. Again, when I have different avenues to provide the care I need, including in-person or tele, I'm not restricted by location, situation, etc. That's flexibility that only telehealth can allow helps me improve care for my patient, and I personally feel more engaged. And that's where the loss of meaning work comes from, because if it feels like you're in a cogwheel in a system and not here to just push paper, but rather than taking care of patient, that also leads to significant moral injury. This all as a way telehealth alleviates these problems. And people have told me, like, and they regularly ask me what have my experience been. It is fantastic. If you have talked to a patient over tele, they might have initial hesitation for it, but the minute that initial hesitation passes, they would love to do that. There are platforms like VeeMed that they're great with their user interface, so that's easy for them to come in and get care. And eventually, when we're going to see increased interoperability, reduction of these burdens, we're going to see more cost-effective, efficient, and user-friendly care. Just to give you an example, CMS has a patient over paperwork, a big push from a policy perspective. ONC, which is healthgov.it, is pushing interoperability and patient access as one of their themes. So good things are coming from the government perspective as well. Please check out all the solutions that VeeMed gives you, including inpatient solution like VeeCart, VeeCast, outpatient solutions like VeeClinic, and of course, one of the best designed physician portals for usability, VeeDoc. These are places you can connect with us online. Again, thank you for your time.